Dr. Angelique Coetze is a medical advisory board member for Solidarity Doctors Network and joins us now from Pretoria in South Africa. Dr. Coetze, always good to have you on this news hour. How concerned are you by this new outbreak, and why are we seeing viruses like Ebola re-emerging?
Yeah, this is really serious. For me, if I compare it with monkeypox, it's like chalk and cheese. Ebola virus is a scary virus, and why are we concerned about it? Precisely because the Sudan viral infection that is currently being seen in Uganda, there's no cure, there's no vaccine that works for the Sudan variant. That's the first problem. The second problem, we know that the case fertility rates can be quite high. We are saying it's 50%, but it can even go up till 90%. So it is a huge concern. And we need to get the message out there to the public. We need to inform them of the clinical symptoms, as you have correctly done in your previous saying when you came onto the screen. So very, very important. Unfortunately, again, there's not really any cure for this, so it's detection. And then early detection to control the outbreak. You need to look at the infection prevention, the control practices in that area where this is happening. You have to do contact tracing. It is extremely important. And as you can see in the pictures behind you, the PPE, all that preventative measurements, very, very important. Also, the burials should be safe, it should be dignified. As you correctly said, it still stays on the surface, so people need to be buried in the correct way.
Yeah, you look at these images and it reminds you so much of what we've just come through, 2 years of the COVID-19 pandemic. And surely there must have been some lessons that the countries have learned because of the pandemic, especially when it comes to vaccines, because there is an Ebola vaccine, but this particular strain in particular, there doesn't seem to be one that's actually effective for it, especially considering that Ebola has usually been in countries in Africa.
Yes, you're absolutely correct. It is mostly in the sub-Saharan Africa that we are seeing these infections and these outbreaks of the different variants or strains of Ebola. And yes, it is true, as we have already alluded to, there is no vaccine for the Sudan strain. The vaccine are more for the Zaire strain and then the Ebola original one. You ask as well, why are we seeing these type of viruses? There's a lot of reasons why we are seeing this. Is not only because of poor vaccination, because there is no vaccines really for Ebola. You can go and get your Zaire strain, your vaccine against the Zaire strain, and then you get the Sudan strain, and it's not going to help and assist you. But a lot of it has to do with also what we call the One Health in Africa and the rest of the world, where there's deforestation, where there's increasingly human and animal vectors coming from the animals to the humans. We see that, and it can be the opposite part as well. Humans also infecting animals. So climate change plays a huge, huge role. There's a lot of reasons why this is happening.
Yeah, it's quite scary with there being so many factors at play. Dr. Angelique Coetze, thank you so much for explaining that so well to us.